Welcome to Tapping Wisdom. I'm Sue Padernacht, and I'm delighted to welcome Dr. Helen Riess, founder and chief medical officer at Empathetics, a neuroscience-based empathy training company, professor of psychiatry at Harvard Medical School, author of The Empathy Effect, and a presenter at TEDx in a show called The Power of Empathy. So Dr. Riess and I have been part of the healthcare burnout community, where we have been both presenters and sponsors at the symposium. And so I asked Dr. Riess to speak with us about this critically important question about how empathetic leadership can really be an antidote to employee turnover in the healthcare industry. So thank you, Dr. Riess, Helen, for joining us. I'm wondering if you could tell us a bit more about yourself and how you got into doing this work.
Well, first of all, thank you for having me. It's such a pleasure to see you again, Sue. So this has been a lifelong passion of mine as a psychiatrist to really delve into the research on empathy because there's so much evidence that without an empathetic relationship in the patient-doctor or leader-subordinate or intercollegial relationships, if empathy is lacking, those relationships typically have more friction and more dissatisfaction. So I got into this work by listening to patients who were unhappy with how healthcare was going. And by listening to them, I and my research team realized they really want more empathic or empathetic care. They don't want people staring in the computer while they're talking to them or ignoring their concerns or putting down their reasons for fear and anxiety. And so through really decades of research and work in how the brain actually processes others' emotions and feelings to allow us to be empathetic and to show that we care, I became really fascinated with improving the patient experience because I realized with some basic training that health providers and all leaders actually could just do so much better by connecting with others and making them feel seen and heard and appreciated. So that work led to some pretty important studies. The most notable is the one where we actually did a study that proved that you can teach empathy, because until that time, many people thought it was an inborn trait that you really can't do much about. And by delving into the neuroscience of empathy at a Harvard Medical School fellowship that I did, I really got to take a deep dive into how our brain actually can perceive and process other people's emotions. And we tested this training that I developed there in a rigorous study, and we showed that patient experience scores actually really rose when people learned sort of the fundamental basics of how you connect. Because we've been working in empathetics for almost a dozen years now, we also have gotten really exciting data on improving wellness because, as you know from our burnout symposia that we've attended, it's a very pervasive problem. And we have found that when you train clinicians in better connecting and empathetic skills, not only do the patients do better, but they themselves feel better about their work. And in a recent engagement that we had with a large health system in California, they tracked how the clinicians were doing. And they actually, by sort of naturally, put half of the clinicians into our empathetics training, and the other half were, on a waiting list. And they found that these clinicians had less burnout, better communication skills, and better teamwork. And then I got an email from the CEO of this organization saying, I didn't expect this, but the empathetics trained clinicians have an 83% higher retention rate at our organization than those that have not been trained. And, they controlled for a lot of factors. And because the biggest crisis facing healthcare CEOs today is this phenomenon of dissatisfaction and resignation and quiet quitting, this was such an important finding for them that what started, as a pilot with 53 doctors is now been rolled out to over 2,000 people in this organization. And my biggest joy is actually to help clinicians get recommitted and reconnected to what brought them into the healthcare field in the first place. And there's a really important leadership component to this that I'd love to talk with you about.
Sure. And many of us have worked with both inspiring leaders and very demotivating leaders. And so, as you've been saying, your research suggests that there's an actual neurobiological difference in how these leaders affect our brains. So, can you talk us through what's happening when we experience these different leadership styles?
Absolutely. So, some of the biggest dissatisfaction and reasons for quitting are a profound sense of loneliness, not belonging, and feeling like you don't matter to the organization, that your leaders don't know you. This became really evident during the pandemic when everyone was isolated, people weren't coming together. And the organizations that we've worked with, where there were regular check-ins from the supervisor, to the workers, even if it was like a 5-minute phone call, how are you doing? Is everybody well in your household? Those people felt like they mattered. Whereas people who were just left with no check-ins started to feel very alienated from their organizations. And, that was a very turbulent, troubling time where feeling like you mattered a lot. And because of all the chaos that whole time period created, when people returned to work, some leaders had this, I think, quite misguided notion that, okay, now we're just going to get back to normal. And there was nothing normal about the world they had returned to. So the leaders who just expected people to come in, pick up where they left off, and start doing work, now of course masked in many cases, but otherwise just get back to it without taking any time to acknowledge what a really traumatic experience this was for everyone.
Mm-hmm. Yep,
So many
absolutely.
people saw more people die in those couple of years than they did in their entire career. Having to tell families that they could not say goodbye to their loved ones. These were really huge traumas. There was a lot of guilt and shame about the corners you had to cut just to get, the work done when there was so little support.
Mm-hmm.
And so these institutions, and this pertains not just to healthcare, but any institution that expected people to come back and just, start working when the whole landscape had really changed, because a lot of the work now is remote, where you didn't really get together with your colleagues, you weren't having lunch in a lunchroom. That risk of isolation just came greater and greater.
Mm-hmm. Yes,
And
absolutely.
so there's a lot of catch up now to do. And the organizations that we've worked with that start with our self-empathy program, which is part of a whole system of wellness and retention training, they are really flourishing because people need to feel seen and appreciated. So when you ask about what's happening neurologically, if you're feeling invisible, like you don't belong, and you feel isolated and unappreciated, you're pretty much in a state of chronic stress.
Mm-hmm.
And we all
Even if
know that
people
when
are
we're,
feeling, maybe even if they're not isolated like we were during COVID, but and the quick return, but even now people are feeling on the periphery, right? They're not central
I mean,
to things. Yeah.
exactly, this whole sense that you don't really belong, you're not part of the in crowd.
Hmm.
I mean, and I think that's being experienced at every single level.
Hmm.
And we all know that our society has changed. There's more rudeness, there's incivility, there's very poor conflict resolution skills. And so people are just kind of at the mercy of other people's emotions and tempers.
Hmm.
And there's no secret to the fact that combined with the work, productivity requirements, documentation, and all the other stressors, that when you mix in incivility and lack of appreciation,
And
some people
misinformation, disinformation. Yeah.
absolutely like
Yeah.
what do you know that people don't even believe? Or what do
Hmm.
people believe that you know is not going to
True.
lead to their health?
Yeah.
That puts people also in the added insult of moral injury,
Hmm.
where they feel like they can't even really be effective in their work.
Hmm.
This has reached such a crisis proportion that the massive scale of resources that's required by poor relationships is estimated to be a $151 billion problem.
Yeah.
It's staggering because when you think about bad relationships, it leads to so many
Hmm.
unintended consequences.
Right, exactly. And that moral injury, is from the bedside to the boardroom, right? I mean, it's up and down and all around, which is why I wanted to talk about solutions. You start with self-empathy because the question becomes, we're putting all this pressure on healthcare leaders to be empathetic, but who's caring for them?
Well,
Right?
that
Where
is,
and so your system starts with self-care, right? So
yes,
there's an independence. And then the next step, of course, is community, but it starts with that self-care. Can you talk a bit about that as part of the solution?
yes, yes. And the wonderful thing about your question, Sue, is that we sort of backed into the self empathy being a leadership offering. Um, Originally, it was intended for the clinicians and for people who had just really struggled and never felt like they came back to their true selves, who had really lost the drive really to take care of themselves and also how to reframe things. You know, when enough people experience trauma, it is easy to pile on to negative stories and just kind of go down this negative, helpless, hopeless vortex. And, you know, people even forget to share good stories about what happens in their day.
Mhm.
So when I say we sort of backed into this, one of the health systems we work with had heard about the self empathy, and the leaders were really intrigued. And they decided that they wanted to try our workshops and our solutions before they implemented it broadly across their uh, institution. So this one organization that had just a brilliant CEO who was actually kind of a new CEO, she said, I want my 30 leaders, my top leaders, to take this course, and I'm going to join. And she had the CFO, the chief nurse, the chief medical officer, even the chief attorney of like all of these very high level C-suite people took our this introductory workshop. And the response was, you know, I really needed this for myself. I thought we were just testing this out for everyone else. And they realized the power of meeting in community, doing some of the exercises that get people to, you know, really think about how am I living? What are my priorities? What am I leaving behind? How am I interacting, not just with my team, but at home? And how am I taking care of myself? So that really kicked off the notion that we start with leadership teams. And this this kickoff introduction is for any industry. It's not just healthcare,
Sure.
because humans are humans.
Mhm. Mhm.
And I would say that healthcare and some other professions are particularly taxing because of the high stakes involved in the relationships. It's like life and death,
Mhm.
or sickness or health, or feeling cared about, or feeling like someone doesn't really give a care about you. And whether you're a lawyer, a business leader, a teacher, a professor, or a parent, these dynamics make all the difference in how the people you interact with feel, and importantly, how you feel.
Mhm. Exactly. And what I so appreciate about starting with self-care for leaders is it's not just an isolated I'm lighting a candle and doing yoga at home. You brought people together in community. And I think it's also important to acknowledge how the clinician identity is a part of the compartmentalizing of empathy going into the profession. And it starts to disentangle that Jungian victim, hero, villain drama.
Yes,
The clinician is the hero, right? That can also start to become victimized. And so you start to really disentangle all of that and put them in a more enabled, healthier place.
so well said,
Yeah.
Sue. I think there are so many ways to elevate leadership capabilities these days. Um, and unfortunately, in many industries, this sort of top down, I know everything, just do what I say, is still very much in place. But workers don't want to put up with that anymore. They want to be valued for what they know. They want to be recognized for contributing to decisions. And I would say that one of the biggest challenges for leaders is how isolated they are, and
Yes.
how many opportunities there are to bring people into the fold and to really learn how to listen,
Mhm.
and
Mhm.
how to strengthen people's ideas rather than use discouragement. Like, oh, yeah, we've tried that. It doesn't work. Yeah, no, they'll never go for it. All these comments like, well, let me play the devil's advocate, which really means I don't agree with you at all.
Yes.
And there are so many of these phrases that leaders almost use unconsciously without realizing how much they are silencing the very people that they need to hear from and who they need to inspire.
It's been settled social science for decades that command and control autocratic leadership is very important in emergency, kind of
Yes, like
urgent
when the ship is
situations.
going down.
Situational leadership goes back, eons, right? So it's situational, but for the most part, you just get compliance. Just get the minimum performance, and people will revert back once that's gone, right? So it's really what you're talking about, where leaders are able to, kind of interact with the whole person, right? And not just bark at people. That people will be committed and they will go over and above and use what Gallup says is that discretionary effort,
Exactly.
right?
Like you can get people to just do their job, but you won't be inspiring them to stretch themselves or to go above and beyond. And, I think there is this sort of classic bad model of the barking leader who's rude and arrogant. But then there's this middle layer, I would say, that has learned to be polite and do small talk and be interested in, how was your son's baseball game? But when you get into a meeting, they may still not really act as if they value
Mhm.
others' opinions. And I think that's the huge loss is a collective set of brains is always better than one.
Mhm.
And when you value other people's opinions and you value that they're thinking, you start to generate sort of an upward mobility in people's minds of like, oh, if she considered that idea, maybe she'd like this idea. And I think the important thing is just not to silence people.
Yeah,
And
so how do you get your participants to be patient with that? Because the other characteristic of clinicians is speed, right? And efficiency. Yeah, and the more opinions that there are, or the more one person is even voicing their opinion, the more time it's taking. So talk about that a little bit.
well, I think a good leader knows how to set the pace of a meeting. And you can't have a free for all every time you get together, obviously, but you can say, you know what, I would like to hear from, you know, one or two people today. And we'll get to, everyone. But like if you're in a 30-minute meeting, you can't open it up. But and then there's a way to just show a lot of appreciation for people sharing something. And then saying, I'd like to hear from everyone or from those we haven't heard from, the next time. I mean, there's just a way to treat people as if they are your most important asset. And I think that's where leaders that's the fundamental error, is that they think of the workers as people who are just going to grind out the widgets,
Mhm,
but not like if I didn't have them,
mhm.
we wouldn't have a company, we wouldn't have a hospital. And it's that human value that I just think there's so much opportunity to burnish the importance and the value of people. And, to just even appreciate in subtle ways what they're doing.
Absolutely. And so if I was sitting on the board of directors and I was querying the CEO of one of your hospital systems about kind of some bottom line, tell me what some of those things that CEO would be proud to say, that what difference this has made, in their culture, in their metrics, et cetera.
Yeah. Well, there's nothing like numbers. And we've been really fortunate that some of our clients are just very, very driven by data and data sets. So, I'm going to just share an anecdote that with one client, the wellness director actually talked about bringing empathetics in, and was rejected. And she went back and she said, I, I can motivate people, I can get them together, but I need a methodology. And I think I found it. Like she had read my book and she'd done research on our company. She went back 5 times.
That's great.
And I love the story because most people would maybe not go back after the first rejection, but she would just show up and just say, let me show you how I think this could work. And then she persisted until, sometimes, the judge says, okay, okay, you win. I don't want to hear
And
from you
each time
anymore.
she learned about what worked. Yeah,
She's very astute.
yeah.
So,
That's great.
yeah, so I'm not saying it's always easy or you're going to get the funding or the permission the first time. But when you have a struggling organization where people are disaffected and quitting and you're spending millions of dollars with, staffing firms to keep filling the vacancies,
Mhm,
it's time to stop and think, what else could we be doing, to keep the good people that we have?
mhm. And
So
you're at risk for increasing medical errors as well, right?
well, you're at risk for really everything with poor
Everything.
relationships.
Mhm.
Just to put some numbers on the dire crisis we're in, the AMA estimates that 8.5% of doctors will quit every year. That's 85,000 doctors a year that are taking early retirement, maybe cutting down to 1 day a week, or just saying, I'm out of here. I want to do something else. Like, we
Mhm,
can't afford this. This is a
mhm,
national threat.
mhm,
And a nursing leadership organization reports that among new nurses, 56% of them quit within the first 2 years of their jobs.
Wow.
Think about that too.
Wow. That's a
All
lot.
that schooling, all
All
the,
that schooling.
and then it's just like, I don't want to do this.
Mhm, mhm,
So we need really inspiring leaders
mhm.
to recognize some of these workers need a little special care. Like the nurses that were trained during the pandemic, they had hardly any clinical exposure. They
Right,
learned online.
right.
And so if you come in there and you realize they don't know a whole lot of things about a physical exam or about how to do things, you need to train your senior nurses to be patient.
Mhm, mhm.
You know, it'll be a little more work now, but it's going to be worse when they quit and we have to start all over.
And we have all those the staffing shortages which we're dealing with. And so those senior nursing leaders, if they have the tools for their own self-care, right? It's almost like being on an airplane. You put your mask on, oxygen mask on first before you put it on your child, right? So get good first, and you'll be
Right.
at your best when you can be with other people.
You really nailed it. Like, if we can teach leaders how to be more welcoming, how to acknowledge success, how to check in with people because they matter, it doesn't even take that much. People think, oh, how do we change this culture? It's impossible. Well, it starts with changing yourself and your expectations. So the other things we do in addition to workshops is that we have short form, we call them micro courses, like 20-minute modules that people take, where they really learn empathic skills. It's not just trying to be nice, it's how do you read people's emotions accurately so that your response is different if someone's showing sadness versus someone showing disgust.
Mhm,
We teach people how to read the face.
mhm,
But if you don't even look up from your computer to look at the face in the first place, you're probably going to make some kind of, uh-huh, yeah. And then how about any shortness of breath, you know, or, did your subordinates get the report in on time? Like not really looking to see, like, is the person upset about the reports not getting done, or are they making excuses, or are they showing like, you know what, we couldn't do it because we didn't have this major data set that we needed to do it. So we teach a lot about the skill of showing curiosity before judgment.
mhm. Yeah, being like reading the room. And what is it about our own neurophysiology that we can tap into and manage so that we can be more curious and more present and more aware of others,
And
so we're not
it's
suppressing
really,
it. We're
yes.
open to it.
And that first piece, of emotional intelligence, which is self-awareness, just taking your pulse before you get together with your team to ask yourself, am I in a good place?
Mhm,
Am
mhm.
I in a place of openness or am I activated? And do I need to take my emotions down a notch so they don't become a contagion for everybody else?
Yes, absolutely. Thank you so much. I so appreciate this. One of my final questions is, what have I not asked that would be interesting, helpful to know and discuss with the audience?
You know, I try to think about not only where we are today, but what this could look like 10 years from now, because I think valuing people and relationships has been profoundly undervalued, and people are hurting right now. And so, my dream is that as we start to invest in, I don't want to just call it training, but invest in like creating relationships, creating work communities where people are rewarded for caring about each other, for collaborating, for helping each other. Like, just think about, instead of moral distress, moral elevation.
Mm.
Like, how could we move from a place where many people are looking all the things that are wrong and talking about the worst part of their day? And we started sharing like the abundance of being in a workforce where you're doing meaningful work, or you're part of a company that is doing really good things for society. Or it might be a company where you're paid well enough to really take great care of your family. So how do we flip the conversation from so much negativity to appreciation and reward the leaders who get this right?
Mhm.
Because whenever we do like a leadership exercise, I always start by asking, think of a leader you really admired, and then think about their qualities and ask yourself, am I showing up that way?
Mhm. Mhm.
I do believe that good leaders are made, not
Yes, yes,
born.
yes. Oh, absolutely, absolutely. It's too complicated a skill set, right? There's
It,
too many,
it,
too many things for it to just come naturally.
there's so much to learn. Yeah.
Yes, absolutely. And this really brings us back to our the essential definition of well-being, which is not just, the emotional, being happy and in a great mood, but it's really more about community and purpose and development and growth and, having a sense of belonging. It's both and, but really it's that second one that it's almost coming back home to our humanity.
That's so well said. I
Yeah.
think when we're in tune with our own human needs and humanity, we're in a much better place to show up that way for others. And that really is the secret to empathy, is
Mhm.
understanding the thoughts and feelings of others and trying to connect in a way that helps them, and it always comes back to help us.
Absolutely. Well, let's end it there. How might my audience find you?
There's info at empathetics.com, which is the company I founded. If they want to learn more about just the empathy topic, the TEDx called The Power of Empathy is available.
Yeah, thank you so much.
You're
It's been
welcome.
such a delight and an honor to interview you. Thank you for joining our community, and I look forward to continuing the conversation.
Thank you. And thanks for your wonderful questions.
Thank you.